So welcome to the webinar, Increasing Implant Case Acceptance Through Effective Communication. And we're going to begin the webinar shortly. And with that, it is my honor to now introduce Tracy Butler, CRDH MFT. She is the CEO of Created Ventures Development Group. Tracy is a multi-talented business leader who is passionate about education. She brings more than 35 years of dental industry experience. Tracy identifies as a strategic problem solver, change agent, visionary executive mentor, and strategic coach. She possesses expertise in talent optimization, the oral systemic link, regenerative dentistry, implant dentistry, function and relation, and service excellence. Tracy believes in building leaders at all levels, and I know she's excited to be here with you. Take it away, Tracy.
Oh my gosh. Yes. Thank you, Jessica. And so grateful for all of you. I just want to echo your remarks. I completely do appreciate you, welcoming everybody tonight. And thank you all for sharing your time with us that we don't get back, but also making the choice to lean into this conversation. So I've been super excited. Like I get so excited to meet and greet and see people, but on a webinar, right? We don't even get to see each other's faces, but I feel as though I feel the warmth, I feel the love already. So let's get started. I do want to make a few disclaimers, right? That this is more, I would say, more of a conversation, not a lecture. And just need a minute here. There we go. So I do want to, again, thank all the folks there at NDX and especially my bestest partner, Jessica. I think she said it best that, she's always there as a resource to help. So thank you for that. And I'm honored to be here to share what my experiences have been and some tips, but I start and get to earn the right to be with you from my clinical experience. So while I'm not a dentist, and I'm so grateful that so many of you doctors are on with us and we'll be leaning into this conversation, I've gotten to work alongside of you all. And the mentorship and the learning that I've received, I'm super grateful for. And so my experience mainly was here in West Palm Beach, Florida, in a busy restorative practice. And then my transition, right, the next decade or so, or 2 decades spent in academia teaching, and then joining many of the large dental organizations and implant leaders in our field and in the sales arena. I consider myself oftentimes a sales and marketing girl trapped in a hygienist body. And I'll explain more about that. But that's somewhat where I really get the muscles around how to have this conversation. And as Jessica mentioned, today I am the CEO of my own business called Creative Ventures, and I'm back independently, helping to elevate entrepreneurs and small businesses to launch and scale. And along with that always comes the conversation of, how do you get people to want to do what you do or say yes to what you do? So if you have your phone handy, you might want to just click on that. That's a way that we can stay connected. This is my digital business card. And of course, you always have, Jessica to reach back to and all the folks at NDX if you need to reach back to me. But as Jessica said, I'm happy to take questions as we move through the program. So if something comes up, jump in the chat. My only disclaimer, again, or second disclaimer, is really around asking you, for us to spend this next 55 more minutes together, if you can clean your slate of all the super cool stuff, the way you do it, and really open your mind and stretch your umbrella. I always say this, and if you were on LinkedIn, you would have seen I posted something this afternoon as I was preparing to see you all. That's like, get some hydration, right? Or I think just water or wine, and something to write with, or something to capture some slides if you want to use your phone. But also just a sponge, come like a dry sponge that's going to soak up some of these things. And I'll tell you, whether or not you learn one thing new, I can tell you one thing I pretty much can guarantee: you're going to leave here thinking differently about the stuff you know. And that's a fundamental, a foundation by which, I lean into all of the programs I'm so honored to deliver. And I start here with a belief that we as a team clinically, and I think wholly, whether we had clinical members of our team or non-clinical, we got to a position in our careers and providing care to patients where we stated this, it was, we believe every patient deserves to have teeth, gums, joints, and titanium live in harmony. And I know doctors, you know exactly what I mean by that. So I grew up in a very busy restorative practice, and we were focused on function and relation. Of course, you know, occlusion, malocclusion, TMD, TMJ, all of the things. We went through Pankey, Dawson, Spear, Coyce, Cranum, and I'm saying that not to name drop, rather to be in such gratitude that I was a part of a team where our doctors welcomed the hygiene team into the conversation. And I'll tell you, they didn't know how dangerous that was going to be, but I'm going to share some of those stories with you. And it really begins way previous to this slide I'm showing you here. But I would say the journey started in about 1994. And then around 2000, it was like things started to click for me. So as my journey I shared with you went from clinical to academia into sales, the sales and leadership arena in dentistry. I was talking to some colleagues at the AO in 2015, and we published an opinion piece, rather, in Compendium. So if you have the 2015 issue, you can read that article. And it really cites that this was the skeleton representation that was shown to me around the interdisciplinary model of care, or the interdisciplinary approach to patient-centric. You know, and so while you're not going to see many clinical photos this evening, what we are going to really dig and get into the heart of is what I call the 51%. So we pushed this integrity button on this skeleton model and said, well, you know what? There's some people missing in the movie, right? Most or all of the successful doctors, dentists, and specialists that I've had an opportunity to know and work with recognize that there are other people integral in the patient experience, right? Like hygienists, myself, or certified dental assistants, expanded functions dental assistants, admin team members. Notice I don't put the front desk. Like, I don't believe people are a piece of furniture, and words really matter. So as you go through tonight, like, I'm going to be a bit of a wordsmith and a bit of a, you know, kind of thorn in your side on how important words are. Right? They're like a bullet out of a gun. You can't get them. So the first one here is to kind of highlight those admin team members and the chairside champions, the assistants, and of course, those first responders in a sense of periodontal disease and disease hygienists. Of course, the lab is the lab as a whole, your lab representatives, the folks at the bench, the folks that are helping you with digital today. The lab is such a key partner, always has been and always will be. Product reps, your product reps that hopefully you're leaning into to use them as a valuable resource, right? They are, put them on your team. I know so many of us early in my career, I was taught to like not see somebody or make sure they don't get to the doctor. And doctors, hopefully you've helped to create a formulary around, that you welcome in these folks at least to understand and make sure that they know that you're looking to place them as a resource on your team. And the specialists, so whether you all are specialists that are joining us, or you're a family practice, general dentist, restorative, comprehensive, complete dentistry, I would say that surrounds, and if you notice in the center, there's no longer the word patient. I'm fully invested in belief around, and I have witnessed the shift from us calling people the patients. I know there are patients, I get it. But when we're going to speak about tonight and really moving forward of helping people out there, those other people with one heart, two lungs, and a credit card to say yes to what we do, the mindset shift we had from a fixed one to a open mindset or a growth mindset was that these are dental consumers. And so that nomenclature is what you're going to hear me refer to multiple times this evening and in other future programs that we'll get to see you on. So All collectively, here's what I want to share. That I love this word interdisciplinary. It was just, as I shared with you, that skeleton representation, it was missing some people in the movie. And clearly, we want to drive the message. And doctors, the message we, as the team members, and hopefully you're empowering your team to see the mouth the way you do, to speak the way you do, and that you're saying the same thing. And I call this I don't call this, I mean, this is a term we know from, it's a military term, force multipliers, that we collectively have this ability to drive the force. And the force in a dental consumer or a patient doctor interaction is they need to own their own level of health or disease. And this is a team sport, the last time I checked. So if I rewind my tape for you and my journey to get to you, it started with, as I shared with you, a busy restorative practice. We grew from a team of 3 to a team of 23 that were, at times surviving, then ultimately striving to have amazing success and hope and cross our fingers, like hope people say yes and hope this works. You guys know what I mean. And to a level where we were completely thriving. And I have to credit our doctors for the discussion we all had around I'll call it a concept. It really was just a belief of what's going on in this thing called the dental equation. And right, whether however many years you've spent in undergrad and dental school or specialty or postgraduate or residency, they probably didn't teach you the dental equation. I sure didn't know, but my doctors were amazing mentors. And I'm telling you, I sit here in such gratitude for all of you. And I want to share with you this conversation we had. It wasn't an easy one, but it didn't happen overnight. The conversation was, how much of what we do is really clinical and how much of what we do is business, because let's face it, I mean, we are in a service business. We are there to serve and help people to make the best informed decisions for their oral and total health. And so we had this great discussion and lots of input. And what we landed on was, well, we all were like, well, it's all clinical, right? It's mostly clinical. I mean, we had the best doctors who went to the best CE. They were the best in their class. We were teaching and lecturing and using the best labs, the best materials. It was all of that, right? And so we were like, we kind of got pretty hubris around this, oh, we're the best clinical. And there's nothing wrong with that. And I'll tell you, most of what our CE, our continuing education, is surrounding is the advances in clinical solutions in clinical dentistry. But I'm here to say we really subscribe to say, well, what if we looked at the clinical side of the dental equation is 49%, and that 51%, this is where we started, right? Where we ended was way different, but where we started was this, okay, open mind. Remember I asked you, keep an open mind, stretch your umbrella, and come with a dry sponge to soak it up. That the 51% of this, what we'll call tonight business acumen, or I'm going to unpack it, is really what not we are looking for, but it's what the patients, the dental consumers, are demanding, right? Consider them the soft skills. So if we just unpack the 49%, the IQ, right? What like you all know vast amounts of information and the way you do it, what works in your hands, right? Even the way you may speak, act. But the clinical skill is you want to be able to deliver. And right, we take an oath, right? What is that oath? To do no harm. And of course, right, you're all striving for excellence or you wouldn't be here. So I acknowledge you for that. And yet I want to just move your IQ, all of what you know, just set that aside for a few more minutes and open your mind to the 51% or the business acumen. If we unpack what's in that suitcase, is a combination of the EQ, the SQ, and the AQ. So let me define those. Your EQ, is many of you have probably read and learned quite a bit about emotional intelligence, or how you show up for others, how others perceive you, how people receive you as well. And in our business, Trust is key. I mean, influence is today's modern currency, and belief or trust is the goal. So that emotional intelligence then packed with these two other pairings of SQ and AQ, your social quotient. How are you being perceived in social settings, like, or your bedside manner? Doesn't always mean social media, but yes, let's talk about that. If patients aren't seeing a presence for you, don't worry. If you don't have a social media presence, your patients have already said either something positive or negative about you. So your social quotient, or even your social quotient in the practice, your chairside demeanor. And then your AQ. This is the adversity quotient. When things just don't go well, because that happens, right? People can't lean back in the chair. We know this. They come late. Somebody has the lead apron. The sensor broke. There's a leak in op 2. All these things happen. Of how do we not only react, but more importantly, how do we respond? And so when we talk about tonight, right, I want to also just share a little secret that isn't in the title, but we titled this Effective Communication, right, to increase your case acceptance in implants. But I got news for you. These skills that I'm going to share with you, and beyond that, the belief and the proof of concept in utilizing them for decades, really can span an influence of case acceptance on any solution you offer. And it really comes to a foundational belief that, and I'm sure you all have heard this, so finish it for me, right? People don't care how much you know. Your dental patients, your dental consumers, they don't really care how much you know. They're coming to you because, one, they expect that they're going to get what they're expecting the best. So that's why they're choosing you. They want to be comfortable, and they want to have options. But ultimately, they don't care how much you know until what? Until they know how much you care, right? And I'm not trying to be so like kumbaya here, because when it comes down to helping human beings to make the best informed decision for themselves, which is your dentistry, right? What you can offer them, your solutions, they've got to believe you. And belief is built over time. It's not like, hey, just trust me because I have a lab coat on and I look official, right? No more is that. Those days are gone. And I spent so many decades chairside, head down in there, deep diving into disease and helping people to not, I always say, die from dirty teeth. So helping people to use the right end of the brush, to come early and often, to ultimately my role I elevated to. I didn't know this in dental hygiene school, but I learned that the more I listened and learned from my doctors, the mentors in our practice, the more I understood their clinical philosophy, the more I could handle objections, the more effective. In fact, I rose beyond even their ability. And it was the best shift when they were like, you know what? I'm going to deliver the diagnosis, and now I'm out. And so I loved the ability to help folks, obviously this type of disease here. I mean, the advancement of this particular patient doesn't happen overnight, but we see people at all levels, and we needed to reach them at their level so we could treat them at ours. And that was the beginning of the conversation, of the shift that happened on our team, whereby we needed to extinguish this fixed mindset, kind of that, arms folded, maybe not physically, but, in your mind, like, well, that's just the way we've always done it. That's not going to work. And to be open to like, okay, well, perhaps, so maybe our doctors didn't have to do it all, right? And doctors, I encourage you, I'm thinking you're here for a very good reason, and not just to get an hour of CE in, and hear me talk and talk, but rather to, lean into this as a resource, lean into me, lean into the team at NDX for, lots of resources surrounding, how to really elevate the patient experience. And I think one of the best, if not the best mentors in the way of service excellence is Horst Schulze. And this is a great, amazing book for those of you that like to read. I personally don't love to read, but I will read this. I will read this kind of literature and books. And I love Horst Schulze for many reasons, but many of you might know that he's the co-founder of the Ritz-Carlton. And right, if you've ever been to the Ritz, you know the experience. I mean, it is a world-class, need we even say 5-star? I mean, it's just, unparalleled. And his book, Excellence Wins, really nailed it for us as a team in like, all right, this growth mindset, we want to be able to serve folks and reach them at their level so we can serve them at ours in that, well, I like to also say a shift from the golden rule, right, which is do unto others as they'd have do unto themselves, to the platinum rule, like do unto others as they would want. And how do we know unless we ask? So we started with ourselves. We started to ask questions internally, right? Like, okay, how can we advance case acceptance, whether it's implants or even crown and bridge, or heck, even somebody saying, okay, I need to come one more time a year and I'm not going to say, oh, unless my insurance covers it. So we started with this question on our team. Would our patients say no to us if they knew what we know? And I know you all are like, well, heck, no. I mean, if they knew everything you know about the implications of waiting, or, just the amputating body parts without even a conversation of replacing them, what that implicates in long-term oral and total health, they would not say no. They would be like, oh, yes, absolutely. So the second question we asked ourselves was, well, what part of no, N-O, do we not understand? Meaning, so often our patients would say no, but it was disguised with a, oh, yes, oh, yeah, the patient's nodding the head, and you're in the clinical room most often, not in a business setting where that's where you need to set up the consultation, but we're delivering this information. And heaven forbid, back in the day, we used to tell people what they needed when they're laying flat down, very vulnerable, not even sitting up, eye to eye, knee to knee, toe to toe. And so the second question, as I said, we asked was, well, what part of no did we not understand? Like, if somebody said no, or even a yes disguised as a no, that yes disguised as a no sounds like, oh, yes, oh, yeah, nope, let me check my schedule. You've heard it. Let me see if I can when I get back to work, I'll check. Or they, even worse, may make an appointment and do what? Cancel or no show, right? I mean, I spent decades helping doctors and teams to eliminate cancellations and no shows. So I think there's two letters missing here, which is the K and the W. It wasn't what they N-O. It was what part of no did we not understand? Like, if they knew what we know, like if they had the knowledge to take action, what impact would that make? And yet there's a responsibility that you and I have in this, what we call in our company, the KAI model. That's knowledge, action, impact. We already agreed, you and I, that when we started tonight, that you would clean your slate of all the super cool stuff you know. But yet you and I, we're going to share knowledge. We're going to share an information tonight. It's what you do with this conversation we're having that ultimately creates impact. If you do nothing, what's the impact? The impact of tonight is, well, that was an hour of your time and you got CE, and that's great. But I would really think you're here because you're of the cusp of our profession that is seeking to improve and achieve excellence. So I know that I'm preaching to the choir in a sense, where I'm asking you to take action ultimately to create what? Lasting impact, to create the solutions and help patients to say yes to the solutions you provide that ultimately impact their oral and total health. So I'm going to show you this model because this is what we call our teaming model. And I have to really give a shout out to Amy Edmondson at Harvard Business School, who really championed this term called teaming, right? Or teamwork on the fly. And I'm like, oh my gosh, when I first went to Harvard, a class there, and took her class. I was like, that is dentistry in a nutshell. Teamwork on the fly, like it better be, right? We already said dentistry is a team sport. We know this isn't easy. It's not easy. You can't do it alone. Or I would recommend not doing it alone. And so we show you this model here. And so you see this communication, clearly defined clinical philosophy, transparency, shared vision, and ultimately at the top, what's that? Trust, right? We know trust is earned, and there's these window moments. So let me begin by saying this is the way the model originally I designed it. And this is a point of our intellectual property. And I wanted to just share with you that we continue to hone and evolve and top grade our content, just the way you would same do with your clinical skill and with your business acumen. So I want to come in here and be of integrity and share with you, like, we've improved upon this model. And so we added something here at the bottom. You see what it's not only about communication, it's also about connection. I'm going to give a shout out there to the likes of a John Maxwell, whether you all are subscribing to what he teaches in leadership and business. He says, everyone communicates, but few people connect. So if we take that foundation of communication and connection, another gentleman that comes to mind is George Bernard Shaw. He's very famous, right, for saying the single biggest problem in communication is what? Well, it's the illusion that it actually took place. Like, we may say something to a patient, we may even give them the results of their evaluation, the diagnosis, and they're not ready to receive it. They might say, nope, I love my pus and infection and missing body part, and I'm going to keep it. Granted, they may not say it in those words, but you know the behavior. The behavior is, let me schedule an appointment, let me check my schedule, and let me just exit this treatment, this place, because these people always tell me I need something every time I come. And so I think around, communication, right? Let's take that first part. What percentage of communication is words? Well, whatever you subscribe to, we know that words are only a small percentage of that communication, right? Whether it be 7, 8%, it's a single digit. And I think you could dismiss that and say, yeah, words don't matter, but words matter, right? That means to me is, if it's such a small percentage, which has been proven in much of the research, we know that I would subscribe to say, well, we don't have many opportunities to fix it. So words matter. I said earlier that words are like a bullet out of a gun, like you don't get them back. So I'm such a fan of this movie. I love remember when Chris Tucker and Jackie Chan are there, and Chris Tucker's like, do you understand the words that are coming out of my mouth? And sometimes in my inside voice, I'm saying that to the patient, and I can see them like, either we've over talked it, like we've sold them out of, we've talked them out of, meaning because our doctors were so intelligent, you guys are so amazing, and gals, like that, we've told them almost too much detail, and it's woven with words here, like you see, just ones that seem innocent, but that can elevate these triggers in patients that they don't love, or they may have limited, or what's called self-limiting language, like words like a little, or heaven's sakes, pain. I mean, we don't want to mention pain. We can talk about discomfort, right? But pain, we don't use that word anymore. I know this is like way long ago. You guys have already erased these words and replaced them. So with probing, like nobody wants to be leaned back and probed, right? We want to measure or evaluate. Gum disease. I had a lady say to me, oh heavens, I chew gum every day, right? And we're like, oh my goodness. So we needed to shift our words to like bone disease. It's a bone infection. And the last one you see here is somewhat of a phrase. And this was one that, and when you really get into the science evidence around motivational interviewing and helping another person to own where they are and then say yes to what you're doing, right? This is honestly, basic sales is, we need to not say we. So a lot of times our doctors, super sweet, awesome clinicians, and a team that was awesome. We would say, what we see, what we, and the patient's just like, when are you going to talk about me? We shifted our verbiage from the what we see and Granted, there's nothing wrong with that, but what's even better is when we can say to a patient, the results of your evaluation reveal you have infection or you have a tooth that's going to need to be not extracted, another scary word, but it's going to need to be replaced with a new root replacement, a new tooth root. You might have heard a dental implant. And here's the good news. We do this every day, right? On and on. So we shifted the we, and to focus it, shine that light back on to the patient. I love this cartoon. It's like my words came out fine, but they were just processed incorrectly. It's kind of like that Jackie Chan, Chris Tucker scene, because it's also tone, right? It's not so much the words, but it may be how people visually see one another, your nonverbal, your body language, or your tone. And so how do we tone down some of the frictiony, prickly, snarky patients that hold up the hand? I don't know if they do that in your practice, but in mine, it was like, oh, honey, just clean my teeth, right? And they didn't want to hear it. Or we had already documented and told them over and over again, and they're coming back with the same documented dentistry that's in the chart. And we needed to get to this place where, how can I reach them at their level so we can treat them at ours, was really the 51%. Remember, we talked about dentistry is 49% clinical and 51% business. That's where we started. I think where we really ended was not to diminish at all. Please don't hear me in that way. That clinical is not important. But when we're reaching today's dental consumer, let me emphasize, today's dental consumer, they want technology, they want high tech and high touch, they want access to care, they want options, and they want to be heard. I mean, this is like, wow, did you learn all that in dental school? No. I mean, many of you probably come naturally, hopefully, with that, all right, because you're in a profession where you got to kind of like people, right? All right, so I want you to do this for me. I want you to grab your phone, because you're going to see something that I'm going to suggest you take a quick snapshot of. All right, so you can have this exercise and take this back to a team meeting or your team as a whole. So sit with me here, right? Get your cameras ready. But before you take a picture, I want you to just experience this exercise. I'm going to ask you 2 questions, and you're going to choose. You're going to self-select yourself into one of these 4 quadrants. Ready? Go. All right. So if you are task-oriented, you're going to keep your eyes to the top of the screen. If you consider yourself more people-oriented, right? You're going to be selecting the bottom of your screen. Ready? Okay. So you got that. Task-oriented or people-oriented. And the next is, if you feel as though you are a quick decision maker, you don't need a lot of time or consideration, or other people in the consideration to take action and make decisions, you're gonna now take that top first question, task oriented or people oriented, and you're gonna select in one of those right quadrants. If you would say, no, Tracy, I really need more information. I need more details. I need the deets. And it takes you a bit more time to make decisions. You're more maybe methodical, or more of a thinker around that, more thoughtful in your decision making. You're going to select one of the quadrants on the right, or the left rather. Okay, so now you at this point should have yourself identified in one quadrant. Ready? We're going to reveal. So I want you to take a photo of that slide, because these are the 2 questions that you're going to ask your team, or you're going to bring as an exercise. Are you task-oriented or people-oriented? Are you quick to make decisions, or more methodical and thoughtful in making your decisions? And now we're going to reveal what quadrant, what does that mean, right? So if you were in that upper right quadrant, you're with me. So we are the fiery reds, or what is often referred to as the controller type. And I want to mention, which I should have mentioned, this is not DISC. This is not your personality. This is your dominant communication style, meaning how you communicate naturally and how you prefer to be communicated with. Guess what? Not everybody has the same style. Okay. So just so you know, it's not DISC. This is your communication style. Remember, we're in the communication and connection foundation of the teaming pyramid. So that upper right quadrant, our mantra is like, be brief, be bright, be gone, right? We can be pretty demanding and determined, pretty purposeful, vision driven, of course. And then I oftentimes would need to collaborate with most of our doctors in the practice were our analyzers. They were like, I need the details, which was amazing because we're doing, high end, fully restorative function relation dentistry. Like I need them to be precise and deliberate. Oftentimes that would come out somewhat formal and even cautious, right? And so there are times where that's a blessing and a curse, I think, on both the controllers or analyzers. All of our earthy greens, right? If you're in that lower left quadrant, as you did the exercise, that's that encouraging, like caring, the patient, very kind and relaxed. These are the supporting folks that just their mantra is just show me you care, right? Just make sure that you show me your care. And of course, our promoters, these are the sunshiny yellows. In that lower right quadrant, those are mostly the, very enthusiastic, positive, outgoing, sociable, dynamic people that are like, hey, I just want to be involved. And I know early in my career, I would find myself more in the sunshiny yellow. And as I developed the skill set and the strength, and I knew where my strengths were in helping patients to fit into their schedule and budget the necessary dentistry that our doctors were diagnosing, I found myself more comfortable and confident in that fiery red, what we'll call the controller communication style. So let's just have some fun here. As you've gotten to know me over the past, say, 40 minutes, we took an assessment and we thought, if you look at this kind of diagram here, right, to the left, right, the too nice, and you want to do you got your plank, right, and you're there and you're actually like, am I too nice? Am I polite and powerful, or am I the tough one? Like, where is the sweet spot to help the person, the patient, the dental consumer that you're serving to say yes to implant dentistry, to reconstructive dentistry, or just to saying yes to coming every 3 months, right? As I mentioned before, the secret here is like what we're talking about tonight translates on any solution you're going to offer as a dental professional, as a team, as a service provider. And so I think early in my career, yes, I was taught to be, I was mentored to be, I was coached to be, I was conditioned to be nice, right? Nothing wrong with that. I got to tell you, being nice though has a price. I'm not saying you don't be nice, but you get where I'm going. I was almost too nice. Like I didn't want to make anybody upset. If somebody said, "Oh, I don't want to hear it every time I come," "Oh no," and don't tell me about that. And then I would just, kind of hallway huddle with my doctor and hope that I didn't make the patient mad. I think as the next 10 years of my career, I moved into this, okay, I can still be nice, but I have confidence. I've learned from what I know. I've seen a thing or two about a thing or two, and I started to learn how to see the mouth like a doctor, not like a mechanic. Right? That's, again, I want to credit our doctors and our team for mentoring that. And we went to an amazing CE, and we went to great clinical programs and non-clinical programs, practice growth and personal development. And I think where I really landed my sweet spot, right? And this is going to be different for all of you, but just take some inventory to think like, where is your sweet spot? Mine is a little bit north, or whatever north, if that's east, there's the ocean, that's east that way, a little bit east of polite and powerful, just before the turn into the tough, right? And I'm a pretty direct communicator. I appreciate direct communication, but I recognize that I need to be able to flex when I'm talking to, say, a sunshiny yellow or somebody who's more that earthy green. Like they need me to slow down, to my voice, my tone to slow down. And if I'm not in that wheelhouse, I might need to have someone else on the team to deliver the case, meaning to have that conversation to help them fit it into their schedule and budget. So it's so important to know, first, your dominant communication style, how you prefer to communicate and how you prefer to be communicated with, and recognize who you are talking to. So that exercise I had you take a picture of is something that you can, yes, use as a team development tool, but you can also use it as a quick reference to like size up your patients, right? And so I know there are a few patients in our practice where I was not the best or poised to be the best to help them to say yes because of my communication style and maybe not my best flexing to get to them. It's something that you can work on, right? So I think you're all picking up what I'm putting down, that ultimately we've got these dental consumers that there's this moment of truth and moment of choice that they go through. The moment of truth is like, okay, I have this condition, or I didn't know that I did, or now they're telling me how important this is to replace this missing body part that I just thought, pull this one and I'll chew on the other side, right? These patients, our dental consumers, go through these 4 quadrants. They go through this quadrant of consideration, education, experience, and advocacy. And this can happen in seconds, it can happen in minutes, and it may even take multiple touches, as many of you know, right? And so that journey, we'll talk about the patient journey from the moment that you've gathered the clinical findings, the diagnostic, the primary diagnostic criteria, and you're elevating these findings to the patient. That's the moment of truth. Well, it's the beginning of the moment of truth. The moment of truth is like, are they hearing you? Do they feel heard? Do they believe you? And ultimately, like, do they trust you? Right. So you understand why when we refer back to the teaming model, that this can take time to build. It's no longer the days of consumerism where just because you're the doctor and the dentist, they should believe you. Like, there's been great research and deep studies on just, where in the tank some of the belief meter is in dentistry with our patients. So the moment of truth to the moment of choice, right? I just want to give you, like, if I were to wave a wish wand and give you one ingredient or one morsel or one tip, I'm not going to call it a trick because this is not a trick, but one concrete tip is well, I grew up on a farm in Iowa, and we were like, you work hard, time is money, right? But I really am of the belief now, through the evolution, shifting from that fixed mindset to the growth mindset, that time is everything, right? 1, we don't get it back. And 2, yes, it's precious. And 3, for what you and I are doing to help people arrest their level of health or disease and to oftentimes rehabilitate their ability to function, eat, chew, digest, live, time isn't on our side. All right. So time has like a triple entendre there. And when it comes to helping patients, these dental consumers, to, well, say yes to a titanium tooth root, or like I said, even it could be one more periodontal maintenance a year. It could be 2 crowns, right? It could be a inlay and onlay. Regardless, I have an amazing, dear friend and colleague, and she always says, thank you, Kathy, for this. She always says, people can't buy a solution to a problem they do not perceive themselves to have. And when we talk about taking and gathering the primary diagnostic criteria, elevating those findings to another human being who's making decisions, and yes, we may think mostly on money, however, right? People buy on emotion and they rationalize with logic. So this is an emotional thing: their mouth, their teeth, their looks, how they feel, their confidence, their lack of, their breath, their all of that, right? That goes into a lot of emotions for patients. And it's really, as I said earlier, I feel like I'm a marketing and sales girl trapped in a hygienist body. Is that marketing is that ability for you and I to transfer value, right? The process by which we create, communicate, and exchange what this is going to do for you. And there's some really brilliant groups in the dental profession today that have figured out it's not selling the implant, it's selling. Yes, I said selling, what this is going to do for you, right? What will this do for you in the confidence, in your ability to eat, chew, thrive, breathe, right? We know arch form and sleep apnea, all that, right? We know its implication with missing body parts. I call them, right? But they're teeth, right? Missing teeth. So marketing, and we even take it one step further. Integrated marketing, right? What's your brand? Like, are you set up? Does your practice say what you do? Like, if you want to do more dental implants, does your website say it? Do your treatment room say it? Does your looping thing in your practice say it? What does your practice say about you? What do patients say about you? Are you consumer centric? Are you focused on that patient experience? People know, I love to say this and hopefully you'll chuckle, but I believe that people with teeth know other people with teeth. And they talk all about us as well. People with missing teeth, like some are missing, some are there, right? We're going to talk about still edentalism is epidemic in our world today in 2024. Hard to believe. But people with missing teeth also know people with missing teeth, and they're either going to refer to you or not. So this is a great ability to elevate the procedures and solutions and services that you all provide. Ultimately, I said before, patients are seeking what? They want to be comfortable. They want to be kept, without pain. They want to be kept comfortable. They want to know they're in the right place, and they want to know they have options. And that fourth thing is they really want and are seeking high touch, high tech. They're looking for digital options, dentistry, and if we don't provide it, they are going to go somewhere else. They are going to look out for that. I hope, by the way, a little plug, I hope you'll join me for the next part of this unofficial series where we get to talk about Let's Go Digital. So back to this here's our teaming model again, right? So communication connection. What do we learn? Everybody communicates, few people connect. Words matter. We need to be mindful of the words we use. We all do need to be saying the same thing, right? From the clinical team to the admin team, from the doctor to the hygienist, and that beautiful loop where including the dental assistant. So the next layer that I want to focus on is the clinical philosophy. Having a clearly defined clinical philosophy, not one where, as I told you, we grew from a team of 3 to a team of 23. We were 4 dentists, 4 hygienists. At some point, we were all doing it, saying it, processing things a little bit differently. And that's dangerous. My words, right? That's just a little bit dangerous where, you can then cause, confusion with patients, right? They might not be able to say yes to you around your shared clinical philosophy. We recognize, right, that this doesn't happen overnight, and patients some of these cases were living under our loops. We agreed as a team through lots of conversation that dental disease doesn't cure itself. It won't be less expensive if we put it off, and it's not going to be any more comfortable than it is today. And so we drew ourselves to understanding the awareness around what's called experiential blindness. And what happens here is so often we see people we know, we see the conditions that we know, we're comfortable there, and we almost can protect them. So if you look here, like I would ask you, some of you right now are seeing this slide and you're seeing, a chalice, right? And others of you are like, no. I see 2 faces, 2 people almost touching, almost kissing. Well, whatever you may see here, right? It's important to recognize that the eye cannot see what the mind doesn't know. And we needed to just eliminate this muscle that we had to just watch things, just wait. We were circling a lot of things with a red pencil and waiting and watching and waiting and watching, right? That we wanted to adopt this, hey, when we see changes, we need to say something. And that meant 1, to the patient, with the patient, about the patient, over the patient, not in the lab, not whispering about our findings and then hoping our doctor would walk in and magically sell the case, right? So this clinical philosophy obviously starts around, some of the clear evidence. We recognize that the most common restored tooth, as you all know, is the first molar. What does that mean? Well, as we have, the most common missing tooth is now our friend, the first molar. In our world, in the late 80s, 90s, and 2000s, where our comfort level is to treat a patient like this, right, was, of course, right, a lot of these teeth end up in a jar, but where did they all go? I mean, if you look at just the statistics, and I'm not trying to throw so many facts at you, because we know facts tell and stories sell. That's where I want to share again. Facts really tell. You could tell people all the facts and facts and facts, but stories really sell. And with this story here of 178 million Americans missing one tooth, I mean, that's number is even growing. I would say edentalism is still an epidemic. And we used to just crown and bridge that stuff, right? 3-unit bridge. If it was a one-tooth problem, we were really great about being able to recommend a 3-tooth problem. And what we know about these cases is there's secondary and tertiary decay. And now what? Now after it's a 3-unit bridge, what is it? That's another 3-unit bridge, or whatever, right? So we asked ourselves these questions: how much disease are we willing to tolerate? And what would you want for yourself? Ultimately, we got to a position where we were of the belief that we believe, as I said when we started, every patient deserves to have teeth, gums, joints, and titanium live in harmony. And I want to be so grateful to and share that with Dr. Peter Dawson, who instilled in us that as healthcare providers, we're clinically, morally, legally, and ethically obligated to inform our patients of their condition and offer them options. They always can say no. So this transparency model that we wanted to, uphold started where we began tonight, when we said people don't care how much you know until they know how much you care. I want you to get out your camera again, because I want to share with you a tool and offer this to you. It's called the transfer of trust, or the 7 steps to prompting. You're going to use your QR code, and this will open up a open format. This is somewhat of a dialogue that we did as a hygiene team, where now we are talking with the patient, over the patient, teeing up the cases for our doctors, right? Not just on perio and restorative, but on implant dentistry. So if you can want to take a little snapshot, that'll open up the tool for you. And I think maybe even Jessica, you and I can collaborate and have this in some of the notes or the follow-up email, what have you. But I wanted you all to have access to this. And it's an open tool, free to you to use. And I just wanted to share that from our heart of the patient experience and crafting that patient experience. That's what we recognized was you got to help people to fit this into their schedule and budget by letting them know exactly what you see, right? And so that, I think, kind of rounds it out. We're getting to time here. You could go fast and go alone, but ultimately it's a team sport. We've already said this, and there's 3 main things I think we want to achieve in the end: is this patient to say yes, to believe us, to trust us, to be loyal, to refer other patients. But they are challenged, right? They're challenged by objections, and we need the team, all of us working together. I love Peter Sange, and he says, a shared vision is not an idea. Rather, it's a force in people's hearts. And it's the simplest level. A shared vision is the answer to the question, what do we want to create? And I feel as though, right, we want to create this beautiful why around why do we do this? Why is this important for a patient to select us and to say yes, to choose us as their healthcare provider? Simon Sinek, let me go back just a minute. Simon Sinek, many of you have read this book, Start With Why. I think it's still so valid that people don't buy what you do, they buy why you do it. And when we look at the main objections, people want to know how long is this thing going to last? How long is it going to take time? Are you going to keep me comfortable? And how much is it? But the first thing people really want to know is, what am I going to look like? Right. And so often, I think, as we're dialing into these objections of time, pain, and money, and time, pain, and money. Yes, these are buying signals, by the way. This is a patient who's like, if there's any questions around these 3 pillars, they are leaning into what you do. Yet I've talked to so many people who are like, we don't have the time, we don't have the money, we don't have, you've heard it all before. And we did some research on our patient base that was like, okay, what are people really doing with their expendable income? And we came to this conclusion that, they're doing a lot of other things, not their dentistry. So just know that as much as we think that we're top of mind for our patients, we may in fact not be. And we're vying for this, expendable dollar. And so when it comes to presenting treatment, especially implant dentistry, or even heck, if you're doing full arch, good on you, right? So needed, so necessary. One of the greatest fears that so many dental teams have and come to us is if a patient is like embarrassed or they feel overwhelmed by the fee, right? It's like you got to feel confident about that. I mentioned earlier that people buy on emotion and rationalize with logic. This is a biological conversation. This is biology happening, right? When you stay and state to a patient what they need, biology takes over. Emotions start happening and they think and rationalize with logic, right? With words. But in the limbic brain is where they make the choice to say yes to you or not. And we believe, I'm hoping you do by now, that your mindset does drive your behavior. And when it comes to increasing case acceptance on implants or any solution, we've got to eradicate that, the way we've always done it, right? TWWADI. And really move to the top of the pyramid, which is trust. And as I wrap up here, or just a shade over, something I believe in, and I think you wholeheartedly would as well, that influence is today's modern currency. And I said it before that trust really is the goal, right? We have the moral, clinical, legal, ethical obligation to inform our patients of their level of health or disease and then craft the experience to help them say yes. It ultimately is our responsibility each as leaders, right, to be that leadership or leading your ship, which starts with you and starts with each of us. And I'm so grateful for this opportunity. I hope tonight that you're thinking differently about the stuff that you'll take and lean into some of the tools and decision trees that we shared tonight and take action. And in the words of Charles Darwin, right, he says, it's not the strongest of the species that survive, nor the most intelligent. It's not the ones that know the most, that biggest IQ, remember, 49%. Rather, those that are most adaptable to change, you and I, right? Leaning into that 51%, that when the 51% is really what our dental consumers or our patients are looking for. So I'm so thrilled to see you on this first of a unofficial series. I hope you'll jump into the pool with us next time. And we're going to explore some of the digital conversation. We've got some great other CE programs coming up, webinars coming up. Here's my email, again, my business card, if you so choose to lean in. I'd love to hear from you all.